This segment of CoastLife is sponsored by Beebe Healthcare.
Well, CoastLife, I am so excited to be joined by Emily Mozal with Beebe Healthcare Marketing and Advertising. She's usually behind the scenes when we introduce you to Beebe's great and wonderful staff members. Emily is a big hand in coordinating all of that, so we're excited that she's joining us today on CoastLife as one of our guest hosts while Paige is enjoying the last of her honeymoon.
I know, that's so great. Thank you for having me. It's a pleasure to be in front of the camera, especially with Dr. Richards.
Yes, and Dr. Richards is who we have joining us on the CoastLife couch today, sporting his pink because October is Breast Cancer Awareness Month.
Yes, it is.
And
thank you for having me.
Yeah, we're excited to have you. And because it's October, this is a good time of year to remind people about the importance of getting screened and, just taking care of those sort of little maintenance things that could turn into something bigger. So first off, Dr. Richards, if you wouldn't mind, just sort of introduce yourself a little bit. What made you want to become a doctor in the first place?
So it's a little bit of a long story, but I'm Matt Richards. I grew up in northern Delaware, so
okay, me too.
Of a local.
Same.
Grew up coming down to this area, so saw all the changes. It really started in college when I was a biology major. I started volunteering in a hospital, and initially I wanted to go more into the pharmaceutical research side, but I really liked working with the people, and I didn't like being kind of trapped in a lab a little bit. That's what it felt like at times. So that kind of shifted my view from the research side to the practical side of medicine, and that's when I started going into medical school direction.
And you're a breast surgeon with Beebe Healthcare, so why is it so important? Just remind us. I mean, I think we hear it all the time around October. It is important to get those screenings and mammograms done, but from your point of view, why is that so important?
It's very important to stay on top of it because with screening, it allows us to catch these diseases at much earlier stages when it's much more treatable and the outcomes are a lot better for women. So it's really important to kind of stay up on that aspect of your healthcare.
Sometimes there's a misconception that women with more breast density are more likely to get breast cancer at some point in their lives. Can you debunk that and kind of explain why that isn't necessarily true?
Yes, so that's something that came out with the new FDA guidelines that we're required to report on everybody's breast density, and that's a good thing in some aspects, but it did cause some confusion with that.
Okay.
Most women have some level of breast density, and it can be entirely normal. For example, younger women do tend to have denser breasts on mammogram, especially young, very athletic women or women who are pregnant. Their breasts are dense, and that's normal. That does not cause an increased risk. Any level of breast density can make it a little bit trickier to read the mammograms. So that's the caveat to all levels of breast density.
Gotcha.
Where we start to talk about breast density increasing your risk is postmenopausal women. You would not expect them to have very dense breasts. The density comes from the glandular components of the breast, the actual functional components, and after menopause, those start to kind of go away in the breast.
Gotcha.
So that density should not be there.
And when it is?
And when it is, that's when you start to have an increased risk of breast cancer.
So then when patients are diagnosed with breast cancer and they end up with the Beebe Breast Health Center, which is a wonderful center. I got a chance to tour it. I think it was around this time last year, and I was just blown away by you guys and all the technology. How can they end up with you guys, and how does that sort of put them really at an overall advantage?
So we do have a breast cancer prevention program where it's considered kind of a high-risk follow-up program.
Sure.
So women who are at higher risk do qualify for additional levels of screening. So for any average risk women, pretty much all women, we would recommend annual mammograms. But once you're in that higher risk category, we can start adding things in like contrast enhanced mammography or MRI.
Yeah, so you're like that top tier tech.
Yeah. Right.
I did know there were different types of mammograms and lab or imaging, not lab, that you could do in order to see deeper into denser material.
Right. So a lot of the mammograms limited by kind of densities overlapping. So if you think of the X-ray like the sun, any dense areas, any glandular component is going to cause a shadow. So the more shadows you have overlapping, the less you're going to see things that are important in there.
That makes sense. That makes sense. So
the MRIs help us in those situations because they look at the tissue a little bit differently, and we can see through some of that.
Oh, cool.
That is cool. Yeah. Very cool. So for women who are listening, and men, but mostly for women who are listening to this interview, and maybe it is time to get that mammogram, get that checkup, how often should they be getting these, and what's the best way to go about it?
There are a lot of guidelines for that too. Breast surgeons in general tend to follow the starting at age 40 for average risk women and then continuing yearly.
Okay.
And there's really not an end date. That's kind of a personalized decision.
I do know that Beebe Milton Imaging does have next day availability for mammograms, and then we have multiple other imaging locations that would have availabilities at later dates, not tomorrow. But that's a great place to start if you need to go and get your mammogram, or if you've never done it, we highly recommend getting that done just to have the most positive health outcomes with you if you have to end up at the Center for Breast Health with one of our 3 surgeons, including Dr. Richards.
Yes, and you're in very good hands when you're with Beebe Healthcare. So thank you, Dr. Richards, for coming in and keeping us informed, and just those good reminders this time of year to make sure that everybody stays healthy. You know, that's what we want for you. But coming up on CoastLife, maybe you're thinking of adopting a pup. We've got a really, really cute one to introduce you to when we get back.